my name is Julia Vollmer.
I'm Sidney Thomas.
I'm Ross Miller.
And we're third years at the University of South Carolina's athletic training program, and today we'll be discussing the steps for shock management.
So first we're going to discuss the different types of shock you might see in an athletic training environment. The first one we're going to talk about is septic shock, which is where you have an increase in bacteria in the body, and the treatment's going to include antibiotics and making sure that you're flushing the system using hydration or an IV.
Anaphylactic shock is caused by an allergic reaction and is often treated with diphenhydramine, epinephrine from an EpiPen, or steroids. Cardiogenic shock can occur following heart damage due to the insufficient amount of blood supplied to the body. Treatment is based off the underlying cause and often includes surgery. Hypovolemic shock is caused by severe blood or fluid loss and is often the result of a traumatic injury. Treatment often includes an IV, or in more serious cases, blood transfusions may be required.
All right, lastly, we have neurogenic shock, which is often caused by damage to the spinal cord following traumatic injury. This is usually pretty difficult to treat because spinal cord damage can be irreversible, which requires surgery, immobilization, and pain management are the biggest steps in treating this.
Signs and symptoms that someone may be going into shock include rapid shallow breathing, dizziness or fainting, rapid weak pulse, weakness, or cold and clammy skin.
All right, so for management of shock, first we want to check on the patient, and if there's any bleeding or broken bones or whatever, we want to splint those and stop the bleeding first. We want to make sure to calm the patient. If they have any tight clothing on or anything like that, we want to cut or remove that stuff. And then we want to put the patient in recovery position, which is where we're going to elevate the patient's legs like this. And then after that, we want to keep them warm with something like a blanket, a large jacket, things like that. Also, we're going to have called EMS and have them on their way. And we also want to put the patient in a recovery position, which may be more comfortable, which is going to be patient on their side. So roll over for me if you can, leg bent, one arm overhead. Yep, just like that. That way we don't have the patient choking on anything if they do end up coughing something up. And you can obviously continue to keep them.